Hi, my name is Darryl, a co-founder of G'day Doctor, a new exciting platform we have taken from overseas, having done tens of thousands of consults and localized. I have personally been in the consumer experience industry for some 35 years, largely with Tier 1 consulting firms, with much consulting to the health industry in leadership positions. My interest in telemedicine arose about 5 years ago when I was building community clinics in Central Asia. For the last 3 years, I've broadly engaged in digital technologies and specifically how they apply to the patient experience. What is striking in many of today's experiences are about any doctor, but with connected living, many in the communities are looking for a higher quality engagement supported by medical history, vitals monitoring, and seamless referrals. This presentation is designed for participants in the healthcare industry and specifically health service providers interested in our B2B platform as a service or B2C health engagement models. Our journey over the next 10 to 15 minutes is to share a little more of who we are, our view of the future of telemedicine, and then how we seek to support your doctor and business practices into the future. Who are we? This is a new venture in Australia. In addition to myself, I am supported by my co-founder, Allan, an ex-corporate secretary for an ASX listed company, and who has been involved in home care and support for doctors' online solutions for some 5 years. Also involved is Jamie, the platform developer from the United States, a gentleman who I've worked with extensively over these last 3 to 4 years on enhancing the journeys not only with working in the platform, but in extending it to the many parties engaged in the patient health delivery experience, the referrals. In addition to our local team, the platform is supported by best practices, ongoing developments, and help desk by our international partner. In the interest of the doctor, patient, and service provider, these players today operate independently. With modern technologies, desires and expectation of patients and doctors, demand for better quality assessment, different ways to support chronic diseases, aged care, and the many interactions, these are demanding for different ways of treatment and monitoring. With COVID, telemedicine is no longer a choice, and globally we are seeing most specialties changing the way they interact with patients online. My experience with healthcare policies is that some 80 to 90% of those policies are covering outpatient services and costs. This has hospital-centered models under pressure, and over time, the any doctor model seen as inadequate for many patients. Signs are the whole landscape of delivery has and will continue to change. Over the past 5 years, I have seen telemedicine evolve, and it is interesting to see which areas were being used. We're seeing from prescription refills, ongoing results from oncologists, pre-post surgery, caring for aged parents and sick children, pregnancy checks, ongoing care for chronic conditions and management, amongst others. This is not inconsistent with today, with more specialty finding new ways to engage. Then consider the gaps in today's landscape due to the basic design of most telemedicine offerings. This leaves a gap in the market for G'day Doctor. The objectives of connected care and patient experience are solving the continuum of care issues patients have dealt with for years. Better quality, access, efficiency. Now with technology, it is about the ability to connect efficiently, receive a personalized quality consult with my information and history, and delivery of the needed additional services. This connectivity is a bit like a phone number. first mover advantage will matter. When we reflect on the area health services, traditional providers are like hubs of support services supporting the doctor in a 5 to 10 kilometre radius. Disruption will occur. Hospital and many service providers enabled by logistics players will become efficient community support hubs, attracting services that were previously taken by small pharmacies and other small health service players. This leads us to consider the role of the platform as a service in supporting outpatient engagement. In one model, we will see the provider, the hospital, using its in-house medical record, reaching out to patients, potentially reaching out of hours with cloud. A second model we'll see is the doctor clinic, requiring support for scheduling, medical records with HIPAA quality, secure video, and seamless access for referring activities. In the middle of all this is the patient. It will be some mix of these, and in many area cases likely to be independent, with hospitals' legal requirements around security of data and the medical record. Which leads us to the journeys we see emerging. The services provided in-house doctors, and we'll see home doctors also possibly being in-clinic doctors, being supported outside the clinic environment, but still respecting the need for the service provider and other services needs, the referrals, and seamless patient care. This leads us to the challenge of what the doctor needs for telemedicine. We're about enabling the doctor with the tools needed: online scheduling, HIPAA end-to-end encrypted video, medical information or history, aligning to vitals, and supporting towards seamless care with the online referring. Economically, it does make sense for the doctors. Some basic stats: online medicine tends to be faster. On an average, an online consult lasts for about 8 minutes. For clinics, health service providers, it enables face-to-face clinic time for more needy acute patients, taking the lesser emergent engagement to be held in a more efficient environment. Is it cannibalizing between the clinic and doctors online? We don't think so. Not only are patients demanding changes, with a shortage of quality doctors, it is more about finding doctors' time. This also becomes a practice management tool for the doctors, with online medical records, scheduling, referrals, payments, amongst other tools, reducing cost structure. And we're in the market attracting patients who want this higher quality long-term relationship with their doctor. We also see companies needing telemedicine support. Protocols, understanding employee health are more than ever tied to productivity, with workplace health and safety requiring medical judgments. For companies never engaged in medical support, a telemedicine platform provides an efficient support to management for proactive health and safety. What have we done? We've taken a tested, successful platform, HIPAA compliant with its tools and support. We've taken the patient view and created journeys relevant to Australia, from illness or identified vital problems to doctors and delivery of services. Our future is incorporating more IoTs and online vital monitoring, as well as working with professional medical groups as to further the online protocols for chronic diseases and other medical specialty management. Our thoughts on vital monitoring is also moving us to the next stage of support for patients and doctors. We recently identified and linked into an online monitoring opportunity, which will see you, doctors and clinics, be able to trace vitals through mobile and provide the platform with medical grade reads of blood pressure, pulse, blood oxygen, stress, heart rate variations, amongst others. This takes us to the next level, with monitoring opportunities on patients and employees without the many gadgets and devices often needed today for these vitals. And of course, it becomes proactive support of patient awareness of their own health. Our business model, we started with connected continuum of care for the health ecosystem, B2B and B2C. We provide doctors what they need for quality online engagement with their patients and access for referrals to local service providers. We support onboarding with efforts involved on onboarding companies to raise opportunity for service providers and doctors. We have a series of tools supporting patients and doctors, and economic models that support the entire ecosystem. Okay, sounds good, but still decisions and the journeys. To clarify your journey, whether you're a doctor, university, hospital, or a group of clinics, we need to clarify what are the issues you are trying to solve, how to deal with medical information and records, payments, scheduling, use of white label or engaging or encouraging the G'day Doctor B2C platform, and understanding your priorities. Want to learn more? Either contact Allan or myself on these numbers, and we'd love to talk to you about why G'day Doctor matters. Thank you.